Good morning. My name is Surili Sutaria Patel, and I'm the Senior Program Manager of Environmental Health at the American Public Health Association. And I have to say I'm honored to be here to introduce you to our next two speakers who are going to be talking about perspectives from the Midwest. But before I do so, I wanted to say a few remarks about climate change and how it is, like Dr. Benjamin has mentioned and Dr. Patz has mentioned, one of the biggest public health challenges of today. There's a saying that's been floating around, and it just doesn't leave me, which is we are the first generation to experience the health consequences of climate change and possibly the last to do anything about it. And that while we're all going to be faced with the challenges, the health impacts of climate change, not everyone is going to be equally resilient to those impacts. And so it's really important to keep in mind as we talk about strategies and policies, to think about those vulnerable populations, those vulnerable communities, including children, the elderly, our tribal communities, those of low income or minority communities that may be impacted disproportionately by climate change's health impacts. And so I hope that we talk beyond solutions, but we talk more about solutions as they relate to equity and climate justice, because they are very, very closely connected to how we're going to be addressing climate change for all, not just those communities that at the greater level. I think somebody made a comment earlier today about what are those targeted approaches to environmental justice. And I think Dr. Patz is onto something. It's about listening. It's about going into those communities and understanding that culture, that historical understanding of that land, of that community is really going to be where we meet those policies and strategies to combat the climate change impacts of health, on health. And so with that, I'm going to turn it over to our great speakers here. First, we have Paul Biedrzycki, or Paul B, as I've known to come to know him. He's the Director of Disease Control and Environmental Health at the City of Milwaukee's Health Department. And then next we'll have Jeff Thompson, the Executive Advisor and Chief Executive Officer at Gunderson Health Systems in Wisconsin. So I'd like to turn it over to you.
Thank you. Thank you. So I assume I'll have did I leave my clicker? Or do I have a slide advancer?
That's right over here. I'll get it for you.
I didn't know if that was it. Thank you, Jeffrey. Thank you so much. Sure. Make sure this works out good. Well, thank you very much for the invite, for the Academies, for allowing me to be part of the planning committee and also to present today. As Surili mentioned, my name is Paul Biedrzycki, or Paul B, as I'm known in the City of Milwaukee Health Department. I've been a health officer there for almost 34 years, so I'm ready to sunset my career. But now I'm attracted to climate and health issues, so you never know. Today, I'd like to present a little bit from a local health department officer's perspective on climate health, including some slides that I borrowed from the National Association of City and County Health Officials based on a survey they conducted of local health officers a couple of years ago. It's the Are You Ready report number 2 that really characterizes the capacity and capability challenges faced by local health departments. And then I want to provide about 4 examples from the City of Milwaukee on climate health adaptation strategies that hopefully you'll find intriguing. Some of these appear to be a little redundant with some of the speakers earlier today, but hopefully you'll find those interesting. So with that, I'll move forward. A little bit about Milwaukee. The mayor would have my head, as they say. I'd be remiss if I didn't mention that little suburb north of Chicago known as the City of Milwaukee. It has a population of about 600,000. The metropolitan area, the MSA, encompasses now about 5 counties, totaling about 2 million people. It is a majority-minority community with a 40% African American population, centered mostly on the north side of Milwaukee. It's a highly segregated community as well, and a growing Latino population here on the south side. These represent, again, some of our lower socioeconomic status populations in the city. We also market ourselves as the freshwater capital, being on Lake Michigan, and a water city with really a growing presence in research, technology, and businesses that are freshwater centered. So you'll hear our mayor often refer to Milwaukee as the freshwater or fresh coast city of the Great Lakes. Public health, local public health in particular, is very well positioned really to deal with climate health issues, even though, again, capacity and capability, as you see, is extremely limited these days. We have in our mission, of course, the assessment, assurance, and policy development core to public health at any level, federal, state, or local. We also have a health disparities focus. There's a lot mentioned about health inequity during this workshop, and I presume will continue, including Cirilli's opening remarks about the importance of health equity and health disparities that are raging in many of our communities. And of course, climate change really exacerbates existing health disparities and inequities in the community. Many public health agencies also can speak fairly articulately on economic, social, and political intersections related to public health, hence the public health in all policies approach that's being advocated at many levels. And of course, we're prevention-oriented. It's the most cost-effective and fundamentally reasonable approach to healthcare. I won't spend a lot of time on this slide other than saying we've described or characterized the many impacts of climate change scenarios during the early part of this workshop. One that I'd like to point out, though, is this idea of community social capital, including, again, the intersection with aggression, violent crime, and social instability that is often underlooked or underemphasized when we talk about climate health issues. We tend to focus on the weather events and some of the now more compelling and better known environmental health impacts to food, water, and air. So that Are We Ready report from the National Association of County and Health Officials. I'm not sure if many of you are familiar with this. This was a second survey, the first conducted in 2008, this one in 2014, I believe, that really surveyed the perceptions of local health officers and local health departments. Many small and medium-sized, certainly in NACHO, a vast majority of their 2,300 members represent small to medium-sized health departments, and really quiz them on, again, their perceptions around climate health, underlying cause, human health impacts, as well as their ability to plan and respond to such of those. Not surprisingly, 8 out of 10 of the health directors recognize that climate change is occurring regardless of the underlying attribution, as compared to 6 out of 10 Americans. Here are some of the scenarios that, again, they brought forth. Many of these, again, are pretty well known to many of you, being weather-related, and some of the more common. Here's one, though, right here on health services or health capacity for the chronically ill that are often a victim when there are disruptions to power or other key infrastructure in the community that's often, again, overlooked. But here you see a plethora of the weather events, including, again, heat-related illnesses, changes to air quality, water quality, and food security. So, one more slide here on the survey. This one I think is kind of the take-home. Probably most importantly on the survey is that less than 5% of local health departments have adequate capacity or capability to plan for impacts of climate change. So this really pushes us to more innovative, cost-effective collaborations within the community, unless funding's coming pretty quickly and in a way I don't understand given the current federal landscape. So it really, again, pushes us to be very collaborative, partner-centric, and innovative in our approaches. So let me talk about those 4 examples here in the city of Milwaukee very quickly on adaptation strategies that I think have been particularly effective. This first one deals with rainfall harvesting, food security, and water pollution. So through a small grant from Linda Rudolph's group at the Public Health Institute, the Climate and Learning Collaborative, we were able to partner with a private sector resource, Reflow Sustainable Waters, to really build rainfall harvesting in 2 community gardens, one serving the largest male homeless center population in the city of Milwaukee, known as the Guest House. The other at Alice's Garden, which provides produce to local markets, local restaurants, again, to ensure access and availability of food to their clientele. Both of these are located in that low socioeconomic area of the north side of the city of Milwaukee. So there are many co-benefits in really implementing rainfall harvesting project at these community gardens. Obvious to food security, reducing runoff pollution, conserving water, and also bringing some visibility to climate, having that climate conversation with the broader community in these types of jurisdictions was incredibly important. So I consider this really a win-win. Again, low cost, not very heavy lifting, creative and innovative, and one way, again, to bring some visibility to this issue within the city of Milwaukee. Another example, given that I oversee communicable disease reporting and response, including to outbreaks in the city of Milwaukee, involves Lyme disease. And if you look at CDC data, you'll see that over the last 25 years, there's been a marked increase in Lyme disease reporting nationwide, particularly in the northeast and mid-Atlantic states. And here you can see, I think, very readily between the last 15 years, the cases of reported Lyme's, a very serious disease resulting in joint pain, rash, can be treated with antibiotics, but has significant potential cardiovascular and neurologic effects later in life, including reactivation. Can be seen a marked increase, almost I wouldn't say a doubling, a multifold, both in the Midwest as well as Northeast, that many believe is connected or has a nexus with climate change. So Lyme disease is transmitted by the black-legged tick or deer tick in our neck of the woods that follows populations of white-footed mice and deer, white-footed mice being the reservoir for the disease, deer being a transporter. And as those animal ecosystems change, so does geographic distribution and prevalence. And indeed, with the redistribution of ticks in Wisconsin, previously seen only in the northwest quadrant, now seen pretty much throughout Wisconsin, changes in surveillance needed to be implemented, as well as not only reporting to local public health through healthcare providers, but risk messaging to healthcare providers on the prevention and treatment, as well as to the general public. And I think that, again, is a demonstration of adaptive technique associated with potential transmission of communicable disease in a jurisdiction. This next slide really highlights a little more innovative approach that we took with corporate America in Milwaukee. We're the home of Miller Coors, of course, Harley-Davidson, Northwest Mutual Life, some very large corporate entities, and I was able to engage them through a relationship on public health emergency planning, particularly post-9/11 bioterrorism and pandemic influenza planning, to engage them on climate scenarios related to business continuity of their operations. In particular, 3 different scenarios, one dealing with power outages during an extreme heat or prolonged heat event, which really attracted their attention in terms of, again, continuity of business operations and maintaining that, as well as water shortages. Some of you might remember that Milwaukee was the epicenter for a cryptosporidium outbreak back in 1993. Yes, I was there. That was a largest North American outbreak of cryptosporidium, and we had boil water advisories in effect for multiple weeks. Again, bringing up the fact that we are on the Great Lakes, water appears to be plentiful, but there are times, as we've seen more recently even in Toledo, with a cyanotoxin or blue-green algae outbreak, that you can have, again, these climate-based scenarios that impact potable water supply. Again, I'm not sure corporate America is thinking in terms of that dimension of climate change. And then, of course, the disease transmission that impacts the entire community, the community being their workforce, the workforce being our community, and bringing them up to speed, whether it be pandemic influenza, Zika virus, or any other communicable disease, attracted their attention in a way that began the conversation about integrating climate scenarios in public health emergency preparedness for purposes of continuity business operations, but also they have this very strong interest in green marketing, especially given that the emerging millennial workforce is has strong sentiments for employment to corporations that are sensitive to sustainability and climate change in general. So that kind of came out. So we held a focus group, we did presentations, we resurveyed, and we're hoping to continue that relationship with corporate America moving forward. My final scenario, again, really deals with heat vulnerability index. At the time, I thought this was groundbreaking. I think we were one of 5 or 6 cities back in 2012-13 that came up with a heat vulnerability index. For those of you that aren't familiar, it's an overlay of various variables predictive of heat susceptibility in the urban environment. Very important given the urban heat island effect you've heard mentioned by other speakers. These variables touch on the natural and built environment, demographic and socioeconomic information, health behaviors in the community. This one represents about 20 variables overlaid on the city of Milwaukee map, and lo and behold, you're seeing impact in those poor socioeconomic areas of the near south and north side in the city of Milwaukee. Not really surprising, but having this type of index, which was funded through the BRACE grant, the Building Resiliency Against Climate Effects grant that you've heard about and will be mentioned later in the workshop, really allowed us to jumpstart strategic decision-making on our heat health task force, where to put cooling centers, how long to keep public swimming pools open, where to target messaging to vulnerable populations. So this was really another win-win that we used. So let me wrap up by talking a little bit about equitable adaptation. Georgetown had a summit about a year ago that really identified some key tenets or principles associated with equitable adaptation. I think this is incredibly important given that we know even small impacts of climate health exacerbate these existing inequities, however you want to frame it, as environmental justice, social justice. But some of the key principles include this trust building between the public and government, which is absolutely essential to get some community-driven planning, innovation, creativity to address climate health scenarios. So it's something we're already building in our plan. We have a community engagement kit in Wisconsin that was funded through the BRACE grant and now is being, again, integrated into local health department emergency planning, especially dealing with climate health scenarios. NACHA also came up, and I'm not going to go in detail over this, the 12 steps to operationalize climate change. This is really meant as a guidance to local health departments given their low threshold for capability and capacity these days, and really is on their website and really, again, underscores some core competencies in local health departments already about community engagement, both in the development, implementation, and then ultimately the evaluation of climate adaptation strategies. So just in summary, some of the things that, again, at the City of Milwaukee we've built into our current climate health planning and response is really inspiring action, especially among policymakers, and making that economic argument that's compelling and convincing to policymakers. And again, at the local level, that's the county executive, the alder people, the mayor's office, that has kind of an economic nexus with, for example, job creation, workforce development, education, early education, or even public safety. Those are the things that resonate with local policymakers these days, and I would hazard to say that they're probably on the top 5 list of many municipal mayors these days: public safety, education, and job creation. Leveraging community networks and resources, because the money just isn't there right now, and I think we need to be very creative about programs in environmental health, communicable disease, and emergency preparedness that are on the ground, infrastructure that's working now that can be, again, you can add a facet of climate health to that fairly easily. Incorporating with economic sustainability programs. Almost every municipality has a sustainability director or program. We've heard from some of those. We'll continue to hear from some of those in the workshop is incredibly important. So that's infrastructure on the ground at the city that really currently doesn't have a strong climate health nexus as far as I can see, but I think that's going to grow in the future. And then finally, advocating for this climate equity is just, I think, incredibly important and something we should keep our eye on. So with that, I'll turn it over to my colleague, Jeffrey. Thank you.